Okay, our patient today was AAO times 3, well nourished, good posture and position, no physical deformities, and normal gait. Appropriate mood and well groomed, appropriate speech. Her skin was clear, warm to touch, no lesions, lumps, or bumps, no edema. Her skin was pink and intact. Her capillary refill was less than 3 seconds, and her radial and brachial pulses were present, even, and strong bilaterally. Her head and her scalp, head, and face was no tenderness noted, no lumps, bumps, or lesions. Her palpated her temporal artery with no tenderness. Also palpated her cranial nerve 5 with no pressure felt. Her sinus palpated with no tenderness. Her neck was symmetrical with no lumps or bumps or no swelling. Her carotid pulses were present and strong bilaterally. Also palpated her lymph nodes, the preocular, parotid, tonsillar, the submental, submandibular, and supraclavicular. Her posterior cervical, deep cervical, superficial cervical, occipital posterior auricle, and her carotid, no tenderness noted or swelling. Her carotid was strong and present. Her upper extremities, she had full range of motion and good muscle strength. There was no visual loss in her cardinal test. No hearing loss. Her thyroid was not swollen. There was no cleft palate in her mouth. Tonsils present. Mucous membrane was pink and moist. And her uvula moved up and down when I asked the patient to say "ah." Her S1, S2 was present and heard with normal sinus rhythm. Her apical pulse was strong, and it was heard at the 5th intercostal space, mid-clavicular line. No scoliosis present and was a negative Romberg sign. All peripheral pulses were present and strong. She had a full lower extremity range of motion and good muscle strength. And this concludes my physical assessment